Good morning, everyone. We are the Group 6, and today we will be going to tackle about the genital warts. What is this all about? Where we can get this, including its signs and symptoms, and also the treatments in order to treat this kind of infection. So for starters, genital warts, they are mistaken to be as pimples since yung mga common warts, they can grow on your hands or finger since they're small, grainy bumps that are rough to touch. So genital warts are usually painless growths, so they are caused by the human papillomavirus, which can be passed on through sex without a condom. So in HPV, it is the most common sexually transmitted infection or STI. So this is a virus where mostly people who are in their late teens and early 20s are infected with it. So it can be passed from one person to another during vaginal and anal sex. So there are many different types of HPV. However, some types can cause health problems, and that includes genital warts and cancers. And for another information, HPV is not only transmitted through bodily fluids such as semen or saliva, but through skin to skin contact. So genital warts can appear as a single wart or multiple warts in a cluster. So they can cause itching or bleeding from your genitals or anus. They usually occur 2 to 3 months after infection, but their symptoms have been known to occur from 3 weeks to many years after infection. So the symptoms will be further discussed later as the slide or the presentation is going. Next, people with genital warts definitely can spread HPV, but even after the warts are gone, HPV might still be active in the body. That means it can spread to someone else through sex or close sexual contact and cause warts in that person. It's hard to know when people are no longer contagious because there's no blood test that looks for HPV. Most of the time, HPV is gone within 2 years of when someone was infected. So someone diagnosed with genital warts should have an honest conversation with their sexual partners. So partners need to be seen by a healthcare provider who can check for genital warts and do screening for other STDs. So if you're a couple or knows a couple that plan to continue having sex, both people need to understand that a condom will help lower the risk of spreading genital warts or HPV, but can't completely prevent it.
This is the case report of genital and oral human papillomavirus infection in a 21-year-old patient with a case of genital warts of 1 year's duration. The patient has been in a stable homosexual relationship for the previous 16 months and routinely performs unprotected oral sex on her partner. She presented with multiple large and hardened genital warts and a single small lesion on her lower lip. She has been treated with trichloroacetic 90% applied to the genital area for 4 weeks without any noticeable clinical improvement. A biopsy was then carried out on both her genital area and her lips, and 21 days after the procedure, the genital lesions disappeared completely. Laboratory examinations were then ordered, which both tested negative, and an examination of the larynx was also normal. The patient's partner was also tested, and her hymen was found to be intact, with no alterations found in the colposcopy examination. Both women denied past history of STDs and heterosexual intercourse, although they did declare previous relationships with digital to vaginal and digital to anal practices, as well as vulvar and oral to oral contact. Biopsy results for lesions of the lips and the vulva revealed condylomata acuminate, which is an anogenital warts caused by human papillomavirus. Polymerase chain reaction or PCR tests for human papillomavirus were performed on both lesions, but the viral subtype was not defined. In this case report, the patient presented two clinical manifestations of HPV infection, namely oral and genital warts. Both her lesions were confirmed by histological studies, unlike her partner whose examination results were negative. This case report clearly illustrates the need for specific orientation about HPV infection targeted at women who have sex with women in view of their behavioral pattern and HPV infection pattern. Intact hymen poses a challenge for HPV screening and colposcopy as demonstrated in this case.
The pathophysiology of genital warts. The human papillomavirus, or HPV, is a non-enveloped double-stranded DNA virus which belongs to the family of Papillomaviridae. It is classified by their risk of causing cervical cancer into low-risk and high-risk types. HPV 6 and 11 is a type of low risk associated with more benign lesions that affect the anogenital areas, such as genital warts. This means that it does not spread to other parts of the body or does not invade nearby tissue. This condition is called benign to imply that it is not dangerous or serious. Accordingly, more than 120 different types of human papillomavirus have been isolated, and greater than 40 types of human papillomavirus can infect the epithelial lining of the anogenital tract and other mucosal areas. Here is the flowchart to understand the physiological processes that cause genital warts. First, abrasions due to sexual contact could either be vaginal and anal sexual intercourse and produces microtears to the epithelial cells of the penis or vulva. Virus then enters through the microtears and infect the basal cells. Latent incubation period anywhere from 3 weeks to 8 months prior to manifestations. Viral DNA production within basal keratinocytes following multiplication of keratinocytes. Then, manifestation of warts and lesions. There are certain types of HPV that are high risk which may result in precancerous lesions. Persistent infection can lead to cancer of the vulva, vagina, cervix, and anus.
Clinical presentation. Genital warts, the most known symptoms of genital infection with the human papillomavirus or HPV. Type 6 and 11 of HPV are commonly associated with genital warts. HPV 6 and HPV 11 are low risk types of HPV. Next is cervical neoplasia is associated with other HPV types which affect the anogenital zone. Anogenital zone is the distance from the midpoint of the anus to the genitalia, the underside of scutum or the vagina. And then, genital warts on the genital mucosa are commonly smooth, papular, or pedunculated and often occur in clusters. And also, they will occur within weeks or months after intimate contact with an infected person on the penis, vulva, vagina, cervix, groin, or thigh. So, how would you know if you have genital warts? Genital warts on the vulva, vagina, cervix, penis, scrotum, or anus appear like skin-colored or whitish bumps. They look sort of like little bits of cauliflower. And you can have either one or a lot of warts, and they can be tiny or large. They may be itchy, but they do not hurt much of the time. Symptoms of genital warts. Genital warts usually cause no symptoms other than the warts themselves. Vulvar warts, dyspareunia, pruritus, burning discomfort. Penile warts, occasionally itching. Urethral metal warts, occasionally hematuria or impairment of urinary stream. Vaginal warts, usually asymptomatic, occasionally discharge bleeding, obstruction of birth canal, secondary to increased wart growth during pregnancy. Perineal warts, usually asymptomatic, pain, bleeding on defecation, and itching. And lastly, most patients have fewer than 10 genital warts with total area of 0.5 to 1.0 cubic centimeter.
Now let's move on to the treatment for genital warts. Visible genital warts often go away with time. People may wish to treat genital warts to relieve painful symptoms or to minimize their appearance. However, it can't treat genital warts with over-the-counter wart removers or treatments. That is why we have topical wart treatments that might include imiquimod or Aldera as its brand name that serves as an immune response modifier. It is a type of treatment that mobilizes the body's immune system to fight cancer. That is why by acting as an immune response modifier, imiquimod enhances cells' ability to eliminate HPV infection and clear the wart. Aldara is a treatment that improves a condition of the patient. However, it could not completely remove the disease from the patient. Next is podophyllin and podophylox or condylox as their brand name. Topical treatment of anogenital warts, both external and perianal warts. This product is not indicated in the treatment of mucous membrane warts. It is because we have this squamous cell carcinoma that may also be associated with HPV, which should not be treated with Condylox gel. Now we have this trichloroacetic acid or TCA, a topical medication for chemoablation of warts, including genital warts. It is a powerful chemical that kills warts by destroying the proteins in the cells. After repeated application, it will cause the warts to shrink by eventually disappear. Now, if visible warts don't go away with time, then minor surgery is needed. We have this electrocautery or burning warts with electric currents. This technique is frequently used to treat genital warts. It uses electricity to heat tissue in order to remove abnormal tissue growth, prevent infection, and prevent or stop bleeding after an injury or during surgery. Next is cryosurgery or freezing warts. It destroys the genital warts by freezing them with liquid nitrogen. Experts agree that cryosurgery removes warts up to 90 out of 100 cases. However, it is not used when genital warts are widespread. Laser treatment is common and can be used to destroy genital warts. Local or general anesthetic may be used depending on the number of warts to be removed or the size of the area to be treated. And laser surgery is safe treatment for pregnant women. Next is injections of the drug interferon. It helps the immune system fight viral infections. This medicine is used to treat genital warts which are caused by viral infections. And we have this interferon alpha entry that is made from human proteins. It is used to treat genital warts that occur in the outside of the body. Lastly, we have excision or cutting off warts. Visible genital warts on the penis or vagina or around the anus are removed by excision, which means cutting the warts off with a surgical knife or scalpel. Warts on the cervix may be removed by laser or loop electrosurgical excisions or LEEP. Excision is a surgery that may be used when warts are widespread and a single treatment may be all that is needed. However, may cause more pain than other treatments.
Just for an overview about genital warts, we already know that this type of infection is caused by the human papillomavirus or HPV. Thus, it can be spread through unprotected sexual intercourse, oral contact, or basically any skin-to-skin contact. You can even get this without the engagement of sexual intercourse. And the effects include itching, discomfort, and pain. As for the case of the 21-year-old patient and her partner, the patient was diagnosed with genital warts as there was an appearance of hardened warts and a single small lesion on her lower lip, and from the fact that the patient and her partner admitted having sexual intercourse. Now let's move on to the tests that were conducted for the patient and her partners. First one is the anti-HIV test. Why do they need this specific test? According from the article that I've read, need siya kasi one of the symptoms of HIV is genital warts. Thus, this is useful for them to find out kung may HIV ba sila or wala. But luckily, both of them tested negative. And the next one is Venereal Disease Research Laboratory Test or the VDRL test. So, this test is designed to detect an antibody in the bloodstream when syphilis is present. In other words, this specific examination is a blood test for syphilis. Third one is examination of the larynx, which I believe is called laryngoscopy. Ito siya is to give the doctor a close-up view of the patient's larynx and throat. Again, this is important in order to detect possibilities of RRP or recurrent respiratory papillomatosis. Ito siya is cause din siya ng HPV. And lastly is coloscopy examination. This procedure requires a close examination in the patient's cervix, vagina, and vulva for signs of disease. And for the overall result, both of them tested negative to all the examinations related to genital warts. And now let's proceed to the next slide. So in this passage, it basically means that the patient diagnosed and infected with genital warts can only be suggested with treatments by its physician. Unfortunately, there's still no cure for this infection.
And what do we mean by that? This only means that the warts will temporarily disappear for years, but eventually the warts will reappear. Further, as we can notice in the case, it was approximately 30 days earlier before the consultation when the patient noticed the warts. The advantage of early consultation includes lowering the risks of the spread of infection, preventing worst scenarios like development of cancer, and less appearance of the warts. And just for a fact, when the warts appear in the face, it is called a filiform warts.